Chicago remains a city on lockdown. The number of COVID-19 cases here are on the rise, as are the number of deaths. But it appears some communities are being more severely impacted than others. According to city data, African Americans make up 30% of the city's population, but 52% of the city's COVID-19 cases, and 68% of the city's deaths from the virus.
We're all in this crisis together, but we are not experiencing this crisis in the same way. The distribution of this disease tells a story about resources and inequality.
The statistics suggest black Chicagoans are dying at a rate nearly 6 times greater than white residents. Reverend Marshall Hatch is the pastor of New Mount Pilgrim Missionary Baptist Church in West Garfield Park. He recently lost his sister and compares the COVID-19 pandemic to the 2005 hurricane that devastated the U.S. Gulf Coast.
My oldest sister had been on a ventilator for about 8 days, and then finally she passed away. And so I was sharing with some people, it's almost as if this is, for us, a national Katrina, where you have, the worst of what's going on concentrated among the poorest, the black poor in particular.
This is a COVID-19 drive-through testing site at Roseland Community Hospital on the city's south side. It will process thousands of test results each day, but for years it has faced funding cut issues. The hospital is serving a key role in the community. The more tests done here, the better the role the hospital can play in attempts to flatten the curve. But this kind of service is not cheap. Danny K. Davis has served as Illinois' 7th District Congressman since 1997.
What this is highlighting is the health status and the discrepancies in health status that has been in existence for African Americans for as long as I have been alive.
He says the communities on Chicago's south and west sides have struggled with healthcare access for generations.
If individuals are already sick, already have other predisposing conditions, already is in need and are in need of treatments that they have not gotten, then there's little wonder that they are dying more rapidly and in greater numbers.
Other possible factors behind the higher toll on African Americans include much lower rates of working from home and a high reliance on public transportation. COVID-19 does not discriminate. It cuts through rich and poor, black and white, but it is African American communities that appear to be suffering the most. Dan Williams, CGTN, Chicago.